In today's Medicoapps masterclass, we will learn about Hepatitis A virus. Let's start with the classification. It belongs to the unenveloped positive sense RNA category. The family is Picornaviridae, genus Hepatovirus, and belongs to the Enterovirus 72 category. The morphology, if we see, it's a non-enveloped icosahedral symmetry with a spherical inshape of 27 to 32 nanometers in diameter. The genetic material is linear, positive sense, single-stranded RNA. Coming to the epidemiology, it has an incubation period of 2 to 4 weeks. From period of exposure to symptom, generally it's around 1 month, and this is regardless of the route of infection. The most common human exposure is through fecal-oral route, and the likelihood of secondary infection is moderate. Now there are 2 points which you need to know about hepatitis A virus is it is the only hepatitis virus that can be cultivated in vitro, and it is resistant to ether, acid and heat but sensitive to chlorination. Moving forward to the clinical features, it can be anecteric or ecteric. It is the most common cause of acute hepatitis in children. The prodromal symptom generally includes anorexia, spiky fever, fatigue, malaise and vomiting. There can be a right upper quadrant abdominal pain which follows the ecteric phase within 10 days of the initial symptom, and some cases can be associated with disorder of taste and smell. The lab diagnosis, confirmation of acute cases is generally by detection of IgM specific anti-HAV antibody. These antibodies appears in the acute phase and peaks at around 2 weeks. Now this peak is reached when already the LFT is increased and disappears between 3 to 6 months. The ELISA is method of choice for measuring these antibodies. Coming to the prophylaxis, hepatitis A vaccine, the minimum age of vaccination for hepatitis is 12 months as per WHO. Immunity lasts for around 20 years. There are 2 types of vaccine, killed hepatitis A vaccine and live attenuated vaccine. The killed vaccine is available in India. 2 doses to be given 6 months apart between age of 12 to 23 months of age. Live attenuated vaccine, this is a single dose vaccine as compared to killed hepatitis A vaccine, which is 2 dose vaccine. So single dose to be given between 12 to 23 months of age. And for prophylaxis, especially in cases of frequent travelers, at a dose of 0.02 to 0.05 milligram per kg body weight, normal immunoglobulin every 4 months. Most important point for hepatitis A, which has been frequently asked in PG entrance examinations, are it's a non-enveloped positive sense single-stranded RNA belonging to Picornaviridae family. It is the only hepatitis virus that can be cultured in vitro. It is resistant to acid, ether and heat but sensitive to chlorination. It is the most common route of infection is fecal-oral. Incubation period is around 2 to 4 weeks. Onset of symptom is around 1 month of infection. Irrespective of the route of infection, it is the most common cause of acute hepatitis in children. Confirmation of diagnosis is by IgM antibody specific to hepatitis A virus. There are 2 vaccines, killed vaccine given in 2 doses, 12 to 23 months of age, and the duration between 2 doses is around 6 months. Live vaccine, it's a 1 dose vaccine given anytime between 12 to 23 months of age. For prophylaxis, normal immunoglobulin given to frequent travelers at the dose of 0.02 to 0.05 milligram per kg body weight every 4 months. Thank you.